Hi, I am Dr. Lucy Meier from Third Coast Foot and Ankle, and today we're discussing step number 4 in getting rid of your heel pain. So in previous videos, we have discussed different things such as addressing the mechanics of your foot, addressing the muscles that are contributing to that heel pain, and also the general diagnosis of what heel pain is, which we have decided that the primary cause of heel pain is plantar fasciitis. So now we're going to focus on step number 4, which is addressing the inflammation that is happening around this injury. So once again, to discuss what is happening here, we are dealing with a ligament on the bottom of the foot that is injured. And that injury is at where it's attaching to the heel bone. And when we have an injury, it gets surrounded by local inflammation. Now, inflammation is not a dirty word. We like inflammation in the body because it actually recruits the healing cells to that area to allow our body to rehabilitate and heal. But our body doesn't always regulate it very well or appropriately. And with that inflammation comes a lot of pain, swelling, and discomfort. And so what we want to do is to control that inflammation so we're still getting the benefits of it allowing for the appropriate healing to go down, but to limit some of those side effects of the pain and swelling that are happening during this process. Now, the easiest way to address inflammation at home is to consider icing the area. Ice is a natural, easy way to decrease inflammation. And if you have kids, you know, every single time they get a little boo-boo, we put a little ice pack on that boo-boo and it magically feels better. So we want to be able to do that to ourselves too. Now, when we are icing an injury, the magic time, the magic number here is about 15 minutes. And so anything longer than that is not that important. Anything shorter than that isn't quite doing the job. So we're going to aim for about 15 minutes of icing a day. Some people will just simply put an ice pack on the floor and put their heel on it. That's okay. Some people prefer to do a little bit of massage. There is really no added benefit either way. And so if you want to take the water bottle and freeze it and roll the water bottle on the bottom, I am totally okay with that, but I can't necessarily say it's going to give you any added benefit. If it feels better for you, go ahead and do it that way. Now, there are some people who should not ice. I'm primarily going to single out diabetics or anybody with peripheral neuropathy. That is a disease of the nerves where you can no longer sensate temperature appropriately. And so you can ice too much. You can do things that can damage your skin. And anytime that we're icing, you always want to make sure that you have something between the ice pack or ice itself and your skin so you do not cause skin damage. But in general, if you're a diabetic, you have to be very careful when we're dealing with extreme temperatures like ice. Now, another way to deal with inflammation at home is to use over-the-counter medications such as Aleve, ibuprofen, Excedrin, sometimes even Tylenol. Now, these medications obviously have a benefit of decreasing inflammation everywhere. If you've ever taken them before for a headache or anything else, you do know that they have some benefits to it. But there are always downfalls in any form of a medication that we have. Primarily with this one, it can cause some stomach upset and can cause damage if you are using it chronically. So if you're somebody that's using this already for more than a month, very consistently, it's time to seek help and to contact your doctor. Either call us here at Third Coast Foot and Ankle or your local podiatrist, because you are now beyond that route of where you should be seeing that benefit. We really see the most benefit with anti-inflammatories early on in the disease. And so if you've been dealing with this for months and months and months and months, usually these anti-inflammatory, combating the anti-inflammatory becomes more and more complicated. So those are the simple ways that we can deal with inflammation though at home. And so we're in those situations where we're no longer seeing benefits from that is when we talk about more advanced ways to address this. Now I'm going to bring up cortisone injections because there's something that is used very commonly for plantar fasciitis, but also commonly in a lot of other areas in orthopedics where we have injuries. I want to point out that cortisone can be very safe to be used around ligaments like this, so like the plantar fascia. There is a side effect or a possibility that it could cause worse damage or could weaken the ligament. And so there are some precautions that we do take when we use cortisone in certain individuals that are at higher risk of having further damage down the road. But in general, I'm going to say cortisone can be relatively safe. The other thing is that cortisone, if used too much, too often, can have a detrimental effect on the fat surrounding the heel. And we want fat there, unlike other parts of our body. We really want our feet to be fatty because they allow for cushion and support, shock absorption on the bottom of our feet. And so we do not want to get repetitive cortisone injections because that can decrease that fat content on the bottom of our foot, which could be detrimental. So in general, the reason I don't bring up inflammation early on in the course or early on in the discussion when we are treating plantar fasciitis is because I don't want you to have the misunderstanding that addressing the inflammation is the cure. Cortisone injections, for example, are not the cure. They are just a tool to help control the inflammation that assists the body in healing. But those mechanical things that we discussed earlier, the stretching of the appropriate muscle groups that we discussed earlier, all of those things are essential to getting better also. And so we have to do this in combination to see best results. Now, there are other ways to address inflammation, and what has become more popular, and it has a lot of excitement around it, is cold laser. So laser therapy is using light, very high intensity light, to control your body's cells. And so what it's essentially doing is manipulating the metabolism of your own body. It is making your body more efficient at healing and better regulate the inflammation that is happening around that tissue. So not only are you seeing the added benefit of decreased inflammation, but you're also giving your body greater tools to heal that area faster. And therefore, laser therapy has become very popular in all parts of orthopedics, not just in the treatment of plantar fasciitis. So if you are at that stage where this is early on and you haven't tried a lot of things, I would start with ice and maybe supplement with some oral medication if it is safe for you to take those medications. If you have kidney disease, for example, we do not want you taking those oral medications. So if it is safe for you to take those medications, go ahead and do that. You will see some relief of pain. Just be reminded that this is not a cure to your pain. If you have tried all of those things at home, it is time to now take those next steps in getting control of that inflammation in the area, whether it be through a cortisone injection or through laser therapy or more intense cold therapies. Then we would be happy to help you here at Third Coast Foot and Ankle, or please contact your local podiatrist to take those next steps. Otherwise, I will see you for step 5, our final step in getting rid of your heel pain.